Okay, so for next up, we are looking at the clinical features of vaginal candidiasis. Clinical features of vaginal candidiasis. So, for the clinical features of vaginal candidiasis, of course, that's like there's overgrowth of Candida albicans, especially in the vaginal area, okay, because you are losing the normal flora that should be there. That's a lactobacilli. So so vaginal candidiasis is mostly known as yeast infection, okay, to most women around. It's mostly known as yeast infection. So it's most often caused by Candida albicans. So the clinical features are the signs and symptoms. There's vaginal discharge, so it's thick, it's white, it's clumpy. They call that a cotton cheese-like discharge. There's intense itching. There's a burning sensation. There's redness and swelling. Okay, that's vulva, erythema, and edema. Then when they try to have sex, there's a lot of pain during sexual intercourse. Okay, they call it vaginal thrush too. So clinical findings. Vaginal pH is usually below 4.5. So unlike the bacterial vaginosis where the vaginal pH is now more than 4.5, it's tilting towards becoming basic. For the yeast infection, the vaginal pH is still normal, right? It's not being messed up with. So if you do microscopy, you see that yeast cells are kind of like growing. There's no fishy odor. So if you do a whiff test where you apply potassium hydroxide to the vaginal discharge, is still negative, okay? Escalation of fissures, okay, may be present in some cases. So predisposing factors, like what would make it very easy for you to actually have this issue, is if you use antibiotics. So the antibiotics can actually go on to destroy the good bacteria that should actually be in the vagina, okay? Pregnancy, diabetes mellitus, if your immune system is weak, it could be anything called making your immune system to be weak, okay? Hormonal contraceptives, you are wearing so much tight clothes, okay? There's a risk for vaginal candidiasis for that.